this article reviews the rapidly growing evidence around repeated low-level red light therapy as a novel intervention for myopia control. And red light therapy, ever since like we first heard about it, has been this like really headline-setting topic because of, what kind of results they've got in from it, and then there's been some controversial elements around it.
And specifically, the author have pointed out a couple randomized clinical trial, one of which actually shows that over 69% of those patients have shown reduction of axial length elongation with the use of RLRL in a 12-month period. And what they found was not only does this slow down the axial elongation, but some study actually found that some individuals have shortened the axial length by more than 0.3 millimeter changes and with a slight hyperopic shift in the refractive area. And I'm very intrigued, specifically when the author have touched upon the pathophysiology of how RLR actually work and interact with the eye. Because, when I first touch upon this subject, to be honest, I'm not really comfortable with the idea of putting laser on a fragile young eyes. That is kind
Right.
of scary and kind of like skeptical to me. But the more I read about it, study have actually found there's some scientific basis on that. Specifically, the RRL have shown to enhance the choroidal blood perfusion or circulation, which seems to be able to slow down or reduce the scleral hypoxia. I found it very fascinating, but at the same time, I think as a clinician, I still try to put a caveat that not every kid should be considered red light therapy. And there's I think the next article would be touch upon the potential safety concern about why this matter,
Yeah.
despite all the robust data showing, RRL actually works for patients.